Okay, so next up, we've got one of our DMOs, Dental Maintenance Organization. We've got with MCNA, Dr. Carlos Garcia, the dental director there. So thank you for coming.
Thank you, and good afternoon, everybody. Thank you for your time to be present today. We're going to do a brief topic overview on updates that we have in MCNA and the other topics that we consider to be very important for you providers. We're going to talk about new dental codes, the endodontic therapy, the ADA alloy classification, crown certifications, lab receive, top reason for claims denials and provider appeals, peer-to-peer meetings, STAR program, provider relation map, upcoming trainings and webinar, and important web links. Our purpose here is just to make sure that you understand that the better that we explain for providers, the best way is on the submission of claims and pre-authorizations, the easier for you to get that process without any kind of problems. And every time that I have an opportunity to have a peer-to-peer, even though that there is a lot of areas that the provider doesn't get involved in the practice, the billing process is something that providers should be close enough to see what they're submitting on their offices. There is a lot of discovery when I start talking with the providers that there's some kind of lack of knowledge of what they're being submitting. And that creates a lot of problems, not only for the provider because they don't get paid on their procedures, but at the same time, they don't know what they're being submitting. So most of the topics that we have this afternoon is just make some clarifications in certain areas. As you already have seen this afternoon, there are new dental providers, new dental codes are being, at this moment, the 9223 is a deep sedation general anesthesia that replaces the code 9220 and 9221. This is a code that is only 15 minutes instead of the 9220 that was covering half an hour. 9243, it replaces the code 9241 and 9242, and 9241 was half an hour code. Now all of these two are only 15 minutes increments. On the 9223, I will recommend all the providers just to submission of the anesthesia time record. That will make a clear presentation of the time that they are billing to us. That helped us a lot, and at the same time, we don't have any kind of problems of approving the time that they are submitting. On the 9243, even though that we are not requiring officially, we always recommend to send that information to. Even though that some of these procedures are not part to be submitted, you know that any kind of sedation code requires for you to have those on the record. So it will be a good idea for us to have that information so we don't have any kind of a problem with that. On the updated descriptor and requirements, the code 9248 is the non-intravenous conscious sedation, is including at this moment minimal and moderate sedation. It requires the documentation in the form of a written, time-oriented anesthetic record to be maintained. That is maintained on your records. This record must include drug administration and dosages. It's very important for all the providers to know that they have to have that on the records, but at the same time, we may require in one moment the submission of those documents. Other area that is giving us a lot of problems too is the endodontic therapy. You know that you have to have submission of pre and post x-rays. We need to have, first of all, one very important area, which is the area of submitting right or left. It's very important for us on the clinical review to have that information. And if you can just have that, it will make our life much easier. The submission of a good preoperative x-ray will include the whole structure of the tooth and basically the apical part of the tooth. It's very important for us to have the whole picture. These are two acceptable samples, that I brought today, so you will see that includes the whole area and basically can tell the condition of those two teeth. On the this is it's considered to be an interoperative or working X-ray, and sometimes I get that submission as the final X-rays. When you have files, still you have the rubber dam in place, that is not considered to be a final. And believe it or not, I'm receiving that on a daily basis. So we urge you to just make sure that the submission includes a postoperative, that it will include the apex of the tooth and the completed treatment. And this is an example of something that it was given to us and was denied because it didn't have it just fell below the standard of care. The other area that it's giving us a little bit of problems and confusion between the providers is the classification of the metals when you're submitting a 2790, which requires the lab receipt for that crown. We're following, as we follow in all the areas, the guidelines of the American Dental Association and the Academy of Pediatric Dentistry. One of the things that on the ADA classification is the difference between a high noble alloy and a noble alloy. And there's some kind of confusion. Basically, the difference is that the high noble needs to have 60% of the combination of gold and the platinum group, which has to have 40% of the gold. On the noble, it can have only 25% of the platinum and gold group. And I have a lot of problems when we are getting the submission of documentation for those crowns. The crown composition has the stickers that basically say the high noble, the predominantly base material, or the noble material. So there is the composition, and if you can include that on the lab submission, it will be a good help for us just to approve the crowns. This is an example of a good lab invoice, which determines the type of metal that was used and the composition of the metal. This is another example, which is only says a full cast crown. With that, I cannot determine what type of metal we have. So unfortunately, in cases like this, I have to deny that claim. There is a lot of submission of the prescription of lab instructions, or even I am getting a packing slip on that area. So just make sure that when the submission is the lab invoice, not a prescription or a packing slip for that. I'm going to go now and explain basically the most common claims adjustment reason codes, and we call it CARC, which are the denial codes that we use for certain for claims or pre-authorizations. They are not in order, but for the Texas Medicaid program, we have the CARC number 2, which is a duplicate of the claim or service. Providers, please don't submit more than once a claim. If the claim by any reason is denied, you have to the process of a resubmission on the reconsideration or an appeal process. So if you submit that for the second time, it's going to be denied as a duplicate. The other part is the CARC number 18, which is the inclusive on another procedure. Certain follow-up or things are submitted are part of the procedure, the principal procedure. And sedation, sometimes the combinations, and you have all of those limitations in the provider manual. So avoiding that, it will help you not to be denied. CARC 46 is a non-covered service. The CARC 48, it needs that has the submission of x-rays or a narrative. And I am receiving a lot of those in certain procedures. For example, in certain extractions that we need to have reassurance of why that tooth was extracted. And the other CARC that is very common is the 402, the main dental home, which sometimes have to do with not the proper submission of the making for sure that you are the main dental home provider for that patient. On the Texas SHIP, it's more or less the same. The only difference here is that you go over the, which is the CARC 44, which is the annual maximum, that is the 564. There are some exceptions to that maximum, which are found in the provider manuals and have to fulfill that criteria and have pre-authorization, which is one of the other submissions that they didn't ask for the pre-authorization to have the treatment performed. The other thing that I have found is on the Texas SHIP that the procedure is denied by 298, which is not a cover on that tooth. A crown that it's not supposed to be covering a specific tooth is submitted. So these are basically the most common things that we're finding still in the program. And I'm sure that sometimes those can be corrected in such a way that you just make sure that you check that before submitting the claim or the pre-authorization. On the appeal process, which is the process that we have, the three major problems that we have is the denial of extractions. You know that is non-wisdom teeth, and I have to explain this. We have a wisdom tooth extraction, which is one specific denial, but in this case, it's the denial of extraction per se. We don't cover asymptomatic teeth to be extracted, so that is a reason for a denial. If you don't explain the narrative, if the patient is with pain or any other symptomatology that the patient will have. The other thing is the clinical criteria was not met. That means that the reason that the procedure was performed, it doesn't fall into the criteria. And the criteria is following, it's written down in our provider manual, and it's part of the guidelines that we have for the program and the guidelines for the, from the American Dental Association and the Academy of Pediatric Dentistry. And the other reason for Texas Medicaid is a claim denial itself, because you were not the main dental home provider or any other procedure that is not covered under the plan. So those are the three major things that we have on the appeal. On the CHIP program, we have more or less what I have been saying before. If you don't pre-authorize a treatment that goes beyond the 564, it will be denied because you didn't have a pre-authorization for that. The claim denial because you were not, for example, you were not the main dental home provider for that patient. And the third one, which is the coverage criteria not met, is that the medical necessity was not met following the limitations and the rules that we have in our program. There is always, and on this, I am the one who personally, with one of my clinical reviewers, participate on this. At MCNA, all clinical determinations are made by the Texas licensed dentist. I have a group of, at this moment, 26 clinical reviewers that involve all the general dentistry and all the specialties that are included in the program. And when we request, if I have a pediatric dentist requesting a peer-to-peer, I have a pediatric dentist online for that peer-to-peer. It's always a true peer-to-peer, and all surgeon is the same. So we try to make this up to the request of the provider. The peer-to-peer process gives the opportunity to discuss clinical situations with the MCNA clinical reviewer of the same specialty. And trust me, when I personally have the opportunity to have a peer-to-peer, I would say 95% of the results is education that the provider needs to have, clarifications of certain areas that they were not aware of. And after the call, we always have a positive result. And this is a very good tool that we're using, because what we in reality want is just to have the quality of care and the program itself and the members to have the best treatment performed. And if you want to have a peer-to-peer, there's a hotline, a provider hotline that is in there. And the other clarification that I want to make is make sure that if there is an administrative denial, like for example, missing X-ray, narrative, timely filing, that is not a clinical decision. is something that you have to go through another process, not with the peer for a clinical decision. We have the STAR program, the Stellar Treatment and Recognition Reward Program. MCNA has been performing this, and it's the same as we started the program. Each main dental home provider who meets the requirement, which I'm going to show in the next slide, will automatically be included in the program, and providers are scored based on the provision of timely preventive care services. The scorecards of our 2015 program will be posted in the MCNA provider portal once the run-out period of complete, which is the early second quarter of this year. Start qualifying criteria: you must have been an active MCNA main dental provider at the end of the plan year, from September 1st to August 31st, 2015. You must have treated at least 150 MCNA members. At least 40% of the members treated have to receive examination, which includes the cost for the examinations, within 210 days of assignment of that patient to you. You must have been in good standing with MCNA and all federal and state agencies throughout the measurement period. And your office must be active with MCNA on the day the recognition reward payment is given. The recognition rewards, the provider rewards are based on the assessment of 5 categories of preventive services: prophylaxis, fluoride, sealants, recall visits, and first dental home visit. Each category above are scored from 0 to 3 stars, and based on that, you're going to fall into 4 different groups. And the first group will be from 12 to 15 stars. The second group will be 8 to 11 stars, 5, 7, and 1 to 4. And the providers that fall into the first 2 groups will have a recognition reward payment. One of the things that we are always saying that we have 11 areas that we cover on the provider relations group. We have internal provider relation people, and we have external representative. They are on this table, and all your areas are covered by MCNA, and you have the person that is in charge of that. And I'm sure that the externals have visited your office, or if not, you can just get in contact with the provider relations department that are internally in the San Antonio office. We have an upcoming training sessions in March 22nd. We're going to have the charting requirements. On April 26th of this year, we're going to have the CHIP dental program. We're going to have updates and follow information on the CHIP program. And on May 24th, we're going to have the common denials, which is what I just briefly covered here. All webinars start at 9:30 a.m. And we have an upcoming in-person lunch and learn training on May the 11th on this address there. These are important web links, which are the American Academy of Pediatric Dentists, the American Dental Association, the MCNA Dental website, and the MCNA Provider Portal. Remember, all our guidelines following by the program and the criteria, guidelines for any dental procedure follow the ADA or the AAPD. For additional information, you have the provider hotlines or the MedMed hotlines phones there. And if you have any questions, I will be at the end of this presentation. I'm more than happy to answer.